Ivan, hello.
Hello, hello. Good evening to everybody. Good evening, Turkey. Good evening, Europe. So, thank you very much again.
Finally, the turn is yours.
Yeah, thank you very much for the opportunity to present here my opinion and my expertise in the erbium YAG laser treatment of urinary incontinence. Which is one of the most embarrassing conditions in women's life, since not only sexual gratification is reducing, but also this embarrassment totally makes woman's life. Urinary incontinence affects about maybe 40% of women of all ages, but especially in nursing homes, this comes up to 60%. And most cause of this is trauma from birth, from vaginal birth trauma, which causes urinary incontinence, which we call stress urinary incontinence. But how the life is going on, we have the problem when the woman enters menopause, and where the deprivation of the levels of the estrogen will induce overactivity of bladder and will add to the problem of stress urinary incontinence. So how to cope with this? All international societies that are dealing with incontinence do prefer and do recommend conservative approach, which is on the first level. So when we have a patient with urinary incontinence, we should start with conservative mode. So here is a long broad fan of methods which are non-invasive, from behavioral methods, aerosol stimulation, etc., etc. If you want to start with something which is conservative, and we are, let's say, dealing with stress urinary incontinence, estrogen would not help. But some of the antidepressants, which is duloxetine, has a complex pharmacological effect that produce marked systemic anticholinergic action, which will reduce overactivity of bladder. But also, which is has been recognized by European Medical Agency, and it has indication in Europe also for treating of stress urinary incontinence, because it will enhance the effect of serotonin and noradrenaline for sphincter, for abdominal sphincter. But unfortunately, these articles that came out are of short follow-up, and also only 3 months, and also the problem is with side effects that duloxetine produces. Kegel exercises is the best. But of course, compliance is very low, because after 2 or 3 days of pelvic floor muscle training, a lady has another important things to do. Recently, Fotona launched this one comfortable possibility to treat urinary incontinence, which is called the Intima Wave. And this is, in fact, high-intensity Tesla magnetic stimulation of pelvic floor muscles that can stimulate muscle contraction in the entire pelvic floor area. Clinical studies are going on, and we are hardly waiting results from these studies. And 10 years ago, laser came on the field of conservative treating, non-invasive treating of urinary incontinence. First lady entered the study on September 1st, 2010. It is, in the meantime, more patients were enrolled in clinical studies, which are proving that the evidence that non-ablative and non-invasive area laser treatment is an effective intervention for urinary incontinence. Zdenko explained you the mode of the action, but the fact is that rising the temperature on the surface of vaginal mucosa will retract the collagen for 1/3, and it will also produce neocollagenesis, which can be easily seen on this slide before and after. Here we can see after erbium smooth laser treatment, it is marked production of new fibroblasts, which means new collagen. And on this slide, histological study, you can see situation before and after. There is something new here that you can see here, these holes, which means that this temperature will dilate the capillaries and will promote also neovascularization and better trophism in this area. So I will, just for slight illustration, this is the first study that was published on erbium laser treatment of stress urinary incontinence. It was published in 2015, where we showed that reduction of incontinence is really significant in 12 months follow-up. So we reduced in median for 50% this incontinence, stress urinary incontinence. On this slide, you can see situation before, where all women were incontinent, mild, moderate, severe, or very severe. After the treatment, we have these blue fields that means that they are totally dry here. They are continent at all. And all of these other levels of incontinence reduced. So 72% of patients were experienced improvement. Some of the authors argued that there are no RCTs, no randomized control studies, which is wrong, because first study, randomized control study, was published from Solini and colleagues 2 years ago, showing that incontinence versus sham, this is a laser, this is sham, is markedly reduced if we compare it with the sham. Also, sexual gratification arises with the laser treatment. And for your information, huge clinical randomized control studies are going on in United Kingdom, Vesper studies 1 and 2, dealing with SUI and pelvic organ prolapse, and also on the King's College, first head-to-head study between CO2 laser versus erbium YAG lasers. And of course, we are also hardly waiting to hear from the results. How else we can we prove to enhance the pelvic floor strength? We used also this gadget, which is called perineometer, and we were measuring the tightness of a vaginal wall. So we showed in 12 months follow-up that the vaginal tightness improved through the time. Also, you are very well aware that the Q-tip elevation is a mark of a pelvic floor disability. So after the erbium YAG laser treatment, we reduced the angle of a Q-tip, and also we showed the results in 12 months follow-up. We also use very simple method, which is measuring of post-void residual volume before and after. We showed also in 12 months follow-up that we reduced the post-void residual urine. And what mentioned also Tamer and what mentioned Marko, co-authors with myself in this study, all of you are aware that hysterectomized women are 4.4 times more likely to have a subsequent surgery for incontinence. So our question was, can we help to the lady who was hysterectomized to conservatively enhance her ability to stop unwillingly voiding? And we showed that it is possible, because all hysterectomized women and non-hysterectomized women, even those who have already implanted TVT or TUT, showed marked reduction of incontinence for 85% reduction. So we can easily use this method in hysterectomized women before any other operation and also to the women who have implanted TOT or TVT. So take-home message from this study was that in hysterectomized women, this is a tip, in fact, more sessions will produce a better result. So we can use this in hysterectomized women as well as a good conservative method of reducing incontinence. Zdenko mentioned also recently introduced device from Fotona. When we have non-responders for erbium vaginal laser, which are, let's say, about 15% or more, or we have ICIQ score more than 16, or we have BLPP less than 60 centimeters or of water, we can use this intrauteral probe to enhance capability of urethral and sphincter strength. Maybe you can ask, how can this help? Because the major element here is urethral sphincter. But you should know that about 30% of collagen is based in the urethral mucosa. So when we retract collagen in urethra, we will add to the effect of vaginal laser. And also this was proved by Adrian Gaspar, where he showed that intraurethral laser reduced incontinence measured by ICIQ and also 1 hour pad test. Important thing is to act as soon as possible, not to wait for the lady who is leaking a lot unwillingly. So we have to act before through the generative phase of life, where we have better effects in reduction of incontinence. Of course, we will reduce incontinence in postmenopausal women, but the effect is better in premenopausal women. So if the lady is less than 47 years, if her body mass index is normal, if her ICIQ at baseline is 10 and less, and if her average birth weight of her offspring is more than 3.6 kilograms, she may expect that she will reduce incontinence for sure, at least for 30%, which is clinically good result. Next question is vaginal laser effective for overactive bladder? Let's see what the evidence says. This is a very exciting study, head-to-head study from our colleague Nobuo Okui from Japan, who produced head-to-head study between TOT and the laser treatment to reduce incontinence. And he used 1 hour PET test and ICIQ SF questionnaire. At the beginning, they were all on the start position. At the end of this study, they all reduced for the same manner incontinence, which means that laser, erbium YAG laser, produces effect which is the same as the gold standard to reduce incontinence. In the same study, Okui also analyzed how laser can affect overactive bladder problematic with urge incontinence. And he showed, which was normally and expected, that in TVT and TOT group, the symptoms worsened because of irritability after the implantation. But in erbium YAG laser, reduction was really marked, which means that this is a very good option because there are not side effects that are produced by TVT or TOT. Another exciting study for the same author, where he compared conservative methods, vaginal erbium YAG laser, anticholinergics, and beta-3 mimetics in reducing overactivity of bladder. And after 1 year follow-up, he showed the same, the reduction in all 3 groups, but the reduction in vaginal erbium laser was the only that was significant, which means that this is a very good method to reduce overactivity of bladder. What is the mode of the action? It is not only neocollagenesis, but also reactivating of the extracellular matrix synthesis and improvement of bladder vascularity, which will enhance trophism. Sexual life is deprivated in women who suffer from incontinence. How can we help here? Marco showed us very well that we may use a laser in order to enhance the sexual gratification. And also we showed it here through another questionnaire 3 years ago in MS in Amsterdam, that through 12 months follow-up, we enhanced sexual gratification. This is not only for the incontinence, this is also because of better outlook. Here is a lady, you will see a few images before and after. So this is before, after first and second and third session. And you will agree with me that this situation, not only reducing the incontinence by laser, but this better look will enhance her sexual gratification. On the next slide, you will see how does it function. You will see on the left side, lady who is coughing before laser treatment, and on the right side, after. So please watch. So on the left side is before, and on the right side is after the treatment. So this is very effective treatment to reduce incontinence and also to reduce vaginal laxity. So I will repeat once again after this Zdenko that the laser in medicine is not, the laser are not the same. They are different because they radiate different energy at different wavelengths and produce different effects. Side effects are different. Drilling in some lasers and heating in erbium YAG laser. So adverse events are much less in erbium YAG laser, and what Zdenko showed also, they are only of cosmetic purpose, only vaginal discharge and transient edema, which will pass in few days, and we all announce these side effects to the ladies before the treatment. And I'm very proud to introduce you with the new Cochrane Library vaginal razors for treating stress urinary incontinence new protocol that implemented reference for our group in their protocol. So we are very proud of it. And shyly, but here it is, vaginal razor is coming in the recommendations of a lot of societies all over the world. This is from North American Menopause Society recommendation for usage of erbium YAG laser for GSM. We also mentioned that by the way is Italian Menopause Society first in Europe who recommended this erbium YAG laser treatment in these indications. So how to cope conservatively with the incontinence? Of course, but lifestyle change to stop smoking, stop overweighting, and to work up very, very frequently. And of course, a good add to this is a laser, erbium YAG laser, who supports that 10 years evidence that non-invasive erbium YAG smooth laser is very good option for treatment and is good in complementary medicine for stress urinary incontinence. So why not to use erbium YAG smooth laser? Thank you very much.